Hi, it's Jessica DaMassa with WTF Health. I'm here at the Barcelona Health Hub, and guess who I have with me? I've got the CEO himself, Luis Badrinas. Nice to have you.
Very nice to have you too. Thank you very much.
Thank you. Okay, so first off, tell us about the Barcelona Health Hub for our friends around the world who have not yet had a chance to visit this beautiful campus and your amazing office space.
Well, Barcelona Health Hub is a global ecosystem which consists to connecting people around the world, connecting startups, connecting big organizations, corporates, connecting big hospitals, universities, and investors, just to accelerate the digital transformation in health. So it's a really big project and very nice project to spread away the digital health investment around the world.
Okay, why is Barcelona such a hotspot for healthcare innovation here in Europe?
Well, Barcelona is the right place to be locally because we have a lot of companies around the world, not exactly in Barcelona, but as the reference, the place to be is one of the references in the world is Barcelona, because Barcelona has the beauty, has the right weather, has the right people, has the talent, has the innovation, and has health as well at the same time. So, and also digital, because it's also in Barcelona there are a big ecosystem of startups. So it's a really good place to be here and just to push the startups and the innovation.
So I understand that you have you've had a long career in insurance. So for those who are not familiar with your background, tell us a little bit about your history.
Well, I was managing companies during more than 30 years. First group I was the group Generali Group. I was managing here in a company called Vitalicio. Second was the insurance group of Deutsche Bank in Spain. And the third one was Zurich. Zurich Global Life has a division in Spain, and I was the CEO of Spain of this division. And through this empowerment I had, we did a very good deals with Banco Sabadell, locally here in Spain, and also Santander Global in Latin America. So the company, the life company, became very, very big in terms of market share. And we got the second position in Spain as market share. So this is my background in insurance.
That's so exciting. And I love that you're bringing an insurance background to this health hub, because I often think in healthcare, that's where a lot of startups struggle, is understanding how to work with the people who are paying, with the payers. So tell me a little bit about why you think it's important for insurance companies, on the flip side, to pay attention to the startup community.
Mm-hmm. I think for insurers are two things important. The companies who are dedicated to the health industry, for example, the DKV or Mafre in Spain, or others company, Adesla, Sanitas, all those companies that are exclusively dedicated to give support to the health. This is important, but also the rest of companies that have clients. So many companies have more than 5, 6, 7 million of clients that has to take care for. So there is a good way to understand a little bit more how can they attend their clients, how can they support their clients, and even their employees as well. So there is not only to be more efficient in terms of health products, but also to care about your clients and your employees. So, and also taking the second part of the question is that also the insurance industry need to be on the digital transformation roadmap, and this is the right place to get on board some startups to help in your process or in your business model to transform the organization, this is critically important.
It is, and I love that you're able to speak both languages. You speak English and Spanish, and you speak insurance and startup, which I think is really helpful to bridge the translation.
Is right because, well, since I am here at Barcelona Health Hub, we can say that this is a startup because we started less than 1 year ago from scratch. We were no one then, and now we are more than 130. But next year we will extend our community around the world, and we want to be the reference hub around the world in digital health. So, and then also I understanding what the startups are doing here, because I come from insurance. I didn't know many things about the health industries, and now I really understanding about a little bit more. Iomed, Medictor, Sius, Made of Genes, all those companies that are working here. And also, I understand better the needs from the insurance corporations too. So,
what have you learned? I mean, I love that you're learning so much from the teams that you're working with and the companies that are working with you. What is the biggest thing that you've learned so far?
Well, what I learned is from the part of the corporate. It is neat that the CEO takes the lead just to transform the organization, because it is a real cultural change if you want to implement digitalization in your company, make your company much more efficient, and split completely the legacy business with the new one and applying the new model. And for the startups, I think it's interesting how the startups are solving problems that the people have, and at the same time they are connecting themselves and complementing the services they are providing. So it is interesting. For example, I can give you some example with Medictor, which is a symptom checker that allow the people who join this symptom checker just to know exactly what it feels, what they have exactly. But once he knows the symptom, you can connect with a chatbot with doctors, that the doctor immediately put in contact with you and say, don't worry. Yeah. So you have this one. So, and also it's a way of not collapsing or avoiding to collapse the urgence in the hospitals, which is really important with the aging population, all these important issues around the world. No?
I love it. Good takeaways. No, this is phenomenal. Thank you so much for stopping by and for chatting with me. I really appreciate it. And congratulations on this first year of the Barcelona Health Hub. It's incredible what you're pretty good at being a startup CEO, from insurance company CEO to startup company CEO. I think you've made the transition pretty well.
I think so. I have reinvented myself.
I love it. Luis, thank you so much. I'm Jessica DaMassa with WTF Health. Thanks so much for joining us.